So thank you very much for your attention.
All righty. Well, Dr. Gutman, once again, you've kind of blown our doors off. Tremendous presentation, a wealth of information there. And you're always learning something new. Like I myself noticed hanging around the hockey rinks, like, a good Canadian does. When I was playing hockey, which I mean, most Canadian kids, I'm no different than most of them. We played hockey right up to, we played right up into our men's league and stuff. Never saw inhalers on the bench. But, more recently, I've been into the rink and seen little kids, and they've got an entire tray in the corner with everybody's inhaler. So it is really a progressive problem, and it's fascinating that we have, something that could potentially help them, which is
Absolutely.
very
Absolutely,
exciting.
Doug. Yes.
To all our listeners, in the bottom of the screen, you'll see a Q&A. I have seen some questions pop up in the chat, but I mean, there's like 100 people have, gone into the chat and said stuff. So it's very difficult to find your questions. So the idea is that Q&A at the bottom is where your questions should go, and just questions. And then we can make sure we get as many questions answered as possible. You up for a couple of questions?
Absolutely. Let me just follow up on the incidence of exercise-induced asthma. We see that in the rink because of air pollution. But Doug, one of the major causes of asthma these days is air pollution, and air pollution is getting worse, and the incidence of asthma is getting worse. So not only can you deal with the asthma through raising glutathione by taking Immunocal, you can also detoxify many of these substances that you are being exposed to.
Yes. And you're absolutely right. Most people do live in major cities. And I mean, I even coming into Toronto, which is considered to be a fairly clean city, in the summer, in June, July, and those August, those hot days and I live up in the north, if you're going to the city, you see a blanket of brownish colored
Wow.
haze laying over the city.
Wow.
And everybody, and the millions of people that live there are breathing that stuff in.
Yeah.
So, our lungs are so important, to keep us healthy, and breathing's pretty important. So,
Living
what,
in that city, but also jogging in that city.
yeah. Well, it's fascinating, when you really think of it. What a product, what an opportunity to help people.
Yeah.
All right. So I haven't looked at these. There's some questions here are in Spanish. So Dylan will jump in and help me with that. One of the questions is a recommendation as to, is there a better Immunocal to use for lung issues? This one looks like pulmonary fibrosis. A gentleman started to take Immunocal. He wants to raise his glutathione, but is there what should the dose be? And is a regular Immunocal or platinum or sport, or which would be better?
Probably regular or platinum. If you can afford the platinum, then take the platinum. But you probably should be on at the very least 2 pouches a day, maybe 3 or 4. So in that case, you can mix the regular with the platinum. I do have to give you a word of warning. Sometimes in these lung diseases, when you first start taking the Immunocal, you may actually start to feel a little worse. You may actually start to cough more, bring up more stuff. But bear with it. After a few days or maybe a week on the outside, you will have coughed up a lot and then feel dramatically better afterwards. So you're actually clearing the mucus because of having raised glutathione. So be aware of that.
Makes sense. Dylan, we should go through these. I don't want to miss any. So the next one's Spanish. Let's just go from the oldest to the newest. So Margoff put a question in there at 9:20. If you can answer that one, or I should say translate that one for Dr. Gutman.
Of course, yeah. Let me find it. Um, So, so once again, thank you so much, Dr. Gutman, for being here tonight with us. So we'll
Thank you,
start with
Dylan.
a question from Margot. My question, Doc, is if Immunocal Premium can help with respiratory infections.
Well, Immunocal Premium, I'm assuming she means platinum.
Platinum, yes, sorry.
Absolutely, absolutely. Our studies were originally done with regular Immunocal, but the platinum adds an anti-inflammatory agent, and many of these lung problems do have a degree of inflammation. So taking Immunocal Platinum would certainly help. It also has platinum also has something to lower acidosis. And some of these lung diseases are also associated with an acidotic environment. So yes, the platinum would be a good choice.
Perfect. Thank you so much.
Robert Wood asks, I am taking beta 1 and then comma 3D glucan. I'm not sure if you're familiar with that or not, Dr. Gutman. He's asking, is this a good product? And can it be taken together with Immunocal?
I'm not familiar with the first product. The second one was a beta glucan.
Yeah, 3D glucan, it says. Beta 1 3D glucan. Maybe that's all one thing. I don't know.
Yes. You can take Immunocal with it, but if you take Immunocal, you may not need it. It does similar things, but the Immunocal offers a fuller spectrum of immune enhancing agents, but they're completely compatible.
Perfect. Dylan, next one's yours.
So this one, end-stage pulmonary fibrosis. What can I expect from Immunocal?
Nina, that case that I presented, was almost end stage, and she had just a dramatic improvement. Um, whether this patient will have the same kind of improvement, that would be great. But the person really, really does have to try. And even if we could relieve some of their discomfort and some of their shortness of breath, and maybe even allow them longer periods without oxygen, you would be doing them a big favor. So results aren't guaranteed, and results are going to be varied. But really, you're almost obligated to at least try.
Was that long question, Dylan, or?
No, it was one of the last one in Spanish. I mean, the newest one. Sorry.
Okay. Well, I'm gonna let you take care of the Spanish ones. So here's a question about Nina, actually, a good question because she's come up a couple of times here. How many pouches a day did she take?
Nina was taking 4 pouches a day, and but Nina also was a rather large woman. Nina was at least 250 pounds. But so she was taking 3 or 4 pouches. Definitely at least 2, probably 3 pouches a day. If you can afford 4, then go for it. Uh, but again, initially Nina did have more coughing as she expectorated out all of that ugly sputum, and then started to feel much better, like way better.
Right. You know, I've seen some it pop up in the chat. You know, with COVID, there's been some lingering, lung issues
Yes.
across the board because and there's new ones coming up, RSVs and different things like that.
Yes.
So it's my understanding is that as a general application, Immunocal is beneficial to anybody and everybody who has some scarring or just lingering lung issues after dealing with COVID over the last few years.
Absolutely, and yes, and thank you, Doug. That'll give me the opportunity to welcome people to get a replay of these calls, either through Immunitech, or you can go visit my YouTube channel, and you'll find that episode on colds, the flu, and coronavirus. And of course, we talk about the lung there as well. This is extremely important when it comes to upper respiratory tract infections.
Right. Yeah, it's I go to that YouTube channel all the time. I'm always pulling and sending your videos to people, that have a question. They're just so comprehensive and they cover such a great topic.
Thank you.
So Pedro asks, any success with lung cancer cases?
We haven't with lung cancer. We didn't talk about it today because we had another session on cancer, but definitely in that session, which you could download again, we talked about one of our studies, which was done specifically in terminal lung cancer, and the end result of that study was that after a year, 80% of the placebo group had expired, whereas half the Immunocal group were still alive and kicking. And these were end-stage lung cancer patients receiving chemotherapy and radiotherapy. So the answer is clearly yes.
Right. And we know, I think we talked about the time why there was never any more research done is because it becomes almost an ethical question, right? Because you're having such great results with Immunocal, you just really you can't be comfortable setting up a bigger group study for that when you know that the impact, right? Okay, Dylan, there's a few Spanish ones.
So I've got one here. I hope I can pronounce that word correctly. Okay. Sorry. So it's for a patient with bronchiectasis.
Bronchiectasis.
Bronchiectasis. Perfect.
Very close, Dylan. That was very good.
Yeah, I'll try. I'm doing good.
Yeah. Yes, bronchiectasis is one of those rare conditions that we didn't speak about today, where you have an area of the lung that gets recurrently infected, and definitely, if you can improve the immune system in these patients, then you can help them battle off these infections much quicker and much easier. So yes. Bronchiectasis, that's the name.
And how many pouches could that person take, for example, of Immunocal?
Well, often, some of the times, some of the patients with bronchiectasis are kids. So the kids' dose is at least 0.5 grams per kilo, but for the adults, at least 2 pouches a day, maybe 3.
Awesome. Thank you so much.
Want to do another one, Dylan? There's a few Spanish ones there.
Yes. So if the mucus is a defense mechanism of the organism, how does Immunocal restore the lungs alveoli due to the nicotine in cigarettes?
Okay, I'll have to dissect that question. Mucus is a response by the immune system, and the mucus is produced to protect the lung tissues. The problem is that if this mucus gets too thick or too copious, then it becomes problematic because the mucus itself will block the airways, and especially in a bronchoconstrictive environment, such as what we see in asthma, the closed airways from the spasm of the muscles around the bronchioles with the mucus inside is especially hard for the lungs to clear. So you don't get good gas exchange and you end up with wheezing and coughing. The second part of the question was what, Dylan?
How does Immunocal restore the lungs alveoli? 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 Am I correct?
Yes.
Yeah, due to the nicotine in cigarettes.
That's a more complicated question. If the alveoli are not broken down, then at least you've avoided emphysema. But the mucus there in the smoker is much more of a complex group of chemicals because of the smoke that's involved. I couldn't even begin to list some of the toxins, but definitely some of them will be decontaminated by raising the glutathione. So the way the glutathione works in smoking is in multiple ways. It's an anti-inflammatory, it's a detoxifying, it's helping the immune system. So I would have to spend an entire hour just talking about how glutathione can help a smoker.
I guess, yeah.
I've got one here, Dr. Gutman. Does glutathione help with, again, my turn to try to pronounce something, Dylan. Does glutathione help with the pulmonary alveolar proteinosis?
I'd have to look that up.
Pulmonary alveolar proteinosis. It's protein and then osis on.
Yeah, you're saying it properly. I don't know the answer to that question. If that person can leave their contact number somehow with you, Doug, or with Dylan, I'll look that up and I'll get back to you. I don't know.
Okay, Nellie, you can just PM, like send me a direct message with your contact information. I'll forward that to Dr. Gutman if you like. Dylan?
Hey, I'm not often that stumped.
Yeah.
It happens.
Yeah, it does. Hey, we're all human, and that shows, it's an interesting study because, and the right answer is I don't know. I mean, trust me, I have to say that far more often than you do.
Yeah.
I got to talk to Dr. Gutman. I'll get back to you. Right?
But a lot of the times, these questions that we can't answer, and once we look them up and maybe even study them, we find that we can actually do something to our surprise. I mean, that's how our autism studies started. I kept on getting questions about autism. I didn't know whether Immunocal would help or not. Then I started getting stories that it did help, and finally we looked into it and did a study, and here we are with a patent pending on Immunocal and autism. So please keep those tough questions coming.
Excellent. Dylan, you want to do another one?
Well, I don't have that many regarding lung disease. I mean, we have about cancer, but we already have a session.
Yeah, I have one that's a very specific one. It says I've been taking Immunocal for a while, and for the first time for 10 years, for the first time, he's picked up a dry cough, and his acupuncturist was concerned that it could turn into pneumonia. Is there something he can do? Like, should he take more Immunocal, or is there anything he can do to try and prevent it from getting any more complicated?
I'd have to know more. I'd have to know how much Immunocal he's taking. Certainly, if he's only taking 1 pack a day, then he should at least double it up. I'd have to ask him questions about his humidity level in his home. If he's a Canadian now, he's heating his house, and that knocks the humidity out of the air. So I would suggest getting a central humidifier. But I'd have to know a lot more about this guy. But if he's
Actually,
just
it's a woman. My
okay,
apology. I said I got the pronoun wrong. It's Susie. So sorry, Susie.
okay,
Oh, no disrespect intended there. It's a
sorry,
Susie.
Susie. But if you're only on one pack, double it up.
Right. Good answer. I'm getting some questions that aren't on the topic too.
I have
Here's
I
one.
have a
There's
question. I don't know. I mean,
Go ahead, Dylan. Sure.
so first, does sleep apnea have to do with lungs? And if so, does Immunocal can help that?
Yes, there's a chapter in my book on sleep, and yes, sleep apnea does have to do um, indirectly with the lungs, but sleep apnea patients are not only hypoxic, but they're also glutathione deficient, and they suffer consequent um, manifestations of their glutathione deficiency as well. So, yes, raising glutathione in sleep apnea is a good idea.
Well,
Funny how they related that to lung disease. Yeah, of course.
I have actually sort of like a little mini testimonial. It's Robin says that as a person with pulmonary fibrosis, I can attest to the efficacy of Immunocal Platinum. I'm still alive after 35 years since diagnosis, and she has benefit from more than two. She wants to start taking more than 2 packs of platinum she currently takes. And thanks you for the presentation, Dr. Gutman.
Well,
And
thank her very much for that testimonial. Um, when I hear testimonials like that, it just absolutely makes my day.
mine too. It's beautiful.
Yeah,
It's why it
yeah,
keeps us all going, right?
yeah, yeah.
Bertha asks, for children that need surgery because of severe sinuses, do you have a recommendation for that?
Again, I would have to know what the problem is. Um, Usually, if a kid needs surgery, it's because of an anatomical defect, and in which case he or she needs to have it. If it's for a chronic sinusitis, then medical might help. So again, it depends.
Right.
I have a
Dylan?
question in French here. So I've had the same recurring cough problem for 5 or 6 years. I take one platinum and one Immunocal pouch, of course, every day. Should I take more?
What kind of problem does she have?
Just a recurring cough.
A recurrent cough. It depends. I would have to know why she has a cough. I would have to know why she has a cough.
Right.
Yeah. Well, it looks like we're petering out on questions here.
Right. Well, I have one more.
Okay.
This person is just asking a question about do you have like they have apparently very thick thick mucus and they have severe asthma.
Yes.
So that's really there isn't really a question, just like what could be causing that maybe is the question sort of.
Yeah. Yeah. Number one, the person needs to be drinking a lot of fluids, because simple strategy like that will make the mucus thinner. But one of the drugs that we use to thin mucus, and especially in asthmatics, is aerosolized NAC. But people have also used aerosolized glutathione. People are also using oral NAC and to raise glutathione levels. NAC is known as a mucolytic, and of course, whatever NAC does, Immunocal does as well, but without the toxic, potentially toxic side effects. See, taking NAC, which is a life-saving drug, unfortunately, it does have side effects, usually gastrointestinal. So this is our big advantage over taking NAC. NAC raises glutathione, but Immunocal raises glutathione. It has a much longer half-life. It has no toxicity, and it is the perfect protein. So ask them to increase the amount of Immunocal that they're taking.
Right. One other question that I can answer. Where could I get some of your books written on this subject? But I can let you answer that one, Doctor. I'm going to direct them to where they can get your book.
Depending on where you are, either at glutathione.org or from Amazon.
Excellent. And what's the title of the book they're going to look for?
The Comprehensive Guide to Glutathione.
Comprehensive Guide to Glutathione. So everybody got that.
Okay.
All right. Well, listen, thank you so much. Or do you have something, Dylan?
Yeah, one last question, because it's the only two questions we have in French, and it have something to do with the question that we had before. What is the link between glutathione and sleep apnea? Isn't this problem linked to a sunken throat? Sorry.
Yes. Sleep apnea can be linked to a throat abnormality or a partial airway closure, usually in overweight people. Now, a low glutathione does not cause these problems, but these problems cause a lowering of the glutathione, so that people who have sleep apnea also become glutathione deficient. And then they have problems from the glutathione deficiency. So that's actually a very good question.
Thank you so much, Doc.
All right. Well, Dr. Gutman, thank you so much for everything. I'm just checking my calendar here. We will be back on the, let's see, looks like the 8th of February.
Okay.
Yes, February starts on the Thursday and the 1st, so we'll be back on the 8th of February with another Glutathione Central. I'd like to thank everyone who attended tonight and for your questions. We apologize if you didn't get them answered. If you put your question in the chat, because I still saw a bunch of questions going into the chat, we just can't find them. So if you put your questions in the Q&A, you have a much higher chance of getting them answered. I apologize if we didn't. Every single question is important to us, and we do our best to try and answer them all. So with that, thank you again for your time, and I hope everyone has a wonderful weekend coming up. Tomorrow's Friday, and we'll look forward to seeing you all here again next month. And Dr. Gutman, once again, from all of us, on behalf of the entire team, we have a tremendous amount of gratitude for these, lectures that you're giving us once a month. It's greatly appreciated.
Thank you.
Good night, everybody. Thanks, Dylan. Oh, one other thing, if you're still listening, I want to thank Lucien for doing the French translation and Sergio for doing the Spanish translation. Thank you so much to our translators as well. Have a great weekend, everybody, and good night.